Hey guys, my name's Emily Peabody, and I will be presenting on traumatic brain injury for HPR 2120. I hope I give you the opportunity to learn something new today. Alright, to start off, what is a traumatic brain injury? In order for a brain injury to be counted in the traumatic brain injury classification, it must be acquired through external physical force. Alright, so causes of traumatic brain injury. The leading cause is going to be motor vehicle accidents, which is a big reason why we should always be wearing our seatbelts. Some other causes might be from violence or from falling or from sports-related injuries. When you think of a brain injury through sports, you're probably thinking concussions, and yes, concussions are a mild form of traumatic brain injury. Like we talked about before, traumatic brain injury is going to be caused by physical external force, but what is actually happening inside the head that's going to create the long-term or short-term damages that we're really concerned about? Most commonly, there's going to be a tear in an artery or a vein that will reduce the blood flow to the brain. This will create anoxia, therefore causing damage to the brain cells. In cases where you have an open head wound, there is a possibility of infection to the blood-brain barrier. And like we talked about before, from concussions, there will be shaking of the brain. So for the first activity, I have a short 30-second video that talks a little bit more about concussions. I'm going to put the link in back on Pilot so you guys can easily access it right underneath where the link to my video was. Alright, for signs and symptoms of TBI, in some cases the patient might lose consciousness. They might have a headache, be dizzy, nauseous, or throwing up. Along with the dizziness, the patient might have a loss of balance, blurred vision, or ringing in their ears. Other symptoms might be memory and concentration problems or major mood swings. Now, not all of these may occur, and some might appear to be more mild than others, but brain injuries aren't anything to mess around with, and help should be given if you ever think there's a possibility that one may have occurred in yourself or someone you may be treating or be in charge of. Brain injuries are going to be classified as three different things. The first group is going to be an open or closed injury. They're pretty much exactly what they sound like. An open head injury will be externally visible and could be the result of an accident, a gunshot wound, or a blow to the head by an object that created maybe like a cut or an open wound, basically. Damage to the brain will be focal, so it's only going to be in one area where the damage occurred. A closed head injury will be caused by shaking, anoxia, or maybe cranial hemorrhages. You won't be able to see it from the outside. These can go unnoticed and can cause some of the most long-term damage because of that. They're not going to be noticed as quickly, therefore they won't be treated as quickly. The effects from this tend to be diffused throughout the brain. The next set of classifications is severe or minor. All traumatic brain injuries do not have to be classified as mild or severe. Some can be in the middle, but this is just a range. Severe traumatic brain injury is characterized by the person being in a long state of comatose. After rehabilitation, there is going to be a number of physical limitations that will remain. Minor traumatic brain injury should still be treated as important, but no formal rehab process is prescribed, and the patient will not stay in the hospital. The last classification scale that is going to be used to measure traumatic brain injuries is the Rancho Los Amigos scale. This scale has 8 different levels that are designed to measure the cognitive function scale of a patient. Level 1 is going to be the lowest level that a patient will exhibit, and they will be exhibiting no response, and the patient will be in a deep comatose state. So that is going to directly relate to a severe traumatic brain injury. Level 8 is the highest functioning state, and the person will be purposeful and will have the ability to integrate both past and present events. So they will be there, and you'll just be able to communicate with them and tell that it's not a severe injury. The statistics on traumatic brain injury are actually a bit surprising. TBI makes up about 30% of all injury deaths. So we're not looking at all the deaths that occurred, just death by injury. So that's 30% again. TBI is the leading killer and cause of disability in children and young adults. Every day in the United States, about 153 average people die from injuries related to traumatic brain injury, and there are about 2.8 million visits to the hospital for traumatic brain injury per year. The cognitive characteristics of traumatic brain injury are going to be short or long-term memory deficits and poor attention and concentration skills. Altered perception and difficulty communicating and reading and writing skills will also be an issue, and there will be a slowness in planning and sequencing events. One of the recommended treatments to help cognitive ability improve is playing Tetris. This game engages visual and spatial processing, critical thinking, and problem solving abilities. So for my second activity, I provided a link to a site where you can play a quick free game of Tetris, and you can just go ahead and post your score in the comments to show you did it. The movement-related characteristics are related to difficulty planning movements, muscle spasticity, and speech disorders. There will be sensory impairments, and the accident may also result in the requirement of crutches and wheelchairs for the remainder of their life, but that is going to depend on the varying degrees of our traumatic brain injury. Behavior characteristics will revolve around cognitive ability. So, your mood swings, lack of motivation, and depression are the three biggest signs, but you can also have like lowered self esteem to go along with the depression, inability to self monitor, difficulty with impulse control, and difficulty relating to others. Special considerations when working with somebody is going to be very case by case. You're going to have to evaluate the person you're working with in order to make the best plan for them, like any other issue they would have. You have to be really careful when working with someone not to jolt their head. Suitable activities that are recommended are bowling, cycling, and swimming. When communicating with a patient, it is recommended to use the top down instruction system, and also frequent reminders and time to process what you're saying will be very beneficial to your patient. The benefits among patients with traumatic brain injury that are immersed into physical activity are huge. The desire to participate in physical activity and better themselves grows. When the patient learns about physical education, it gives them desire to learn more about what they already know and also branch out into other topics that they might find interesting. It gives the patient an opportunity to make goals and reach them, and that's going to give them a sense of satisfaction as in they're achieving something. When it comes to preventative steps to reduce traumatic brain injury, it's actually pretty easy. Please wear your seatbelt. I mentioned it before, but it can seriously save your life and your brain and cut down on severe long-term damages. To reduce child trauma, make sure you put your child in the correct size car seat, make sure the car seat is strapped into your car correctly, and make sure your child is strapped into their car seat correctly. Helmets are huge in sports such as football and baseball. You really want to make sure they fit correctly and you are leaving the game if you experience a hit that could seriously injure you. Stair gates are beneficial to keep children from falling downstairs, and soft play surfaces for children can also prevent injury from falling. Thank you for watching today, and I hope you learned something that can save someone's life or your own one day.